Hello and welcome. This is Dr. Jerry Cuomo. I'm video recording here in my Boca Raton office with a case that is comprised of a new material. As we all know, all ceramics have become a mainstay in our dental profession. This material is called Emax, and it is a dilithium silicate, which is a very strong ceramic material. And so this case is tooth number 3. I'm going to take you through my fit checking technique. This case I have not looked at yet, just came back from the lab. And so I'm going to walk you through what I do with every case that comes in. So I'm here on a Friday early afternoon. No patients in my practice, so right now I'm looking at lab cases. I'll do this one, finish it, finish it, and then make the adjustments, show you how I go through the adjustments, and then my next video I'll take another case and walk you through that as well. So cases are coming in. Now I can start to get ready for the fit checking before we present it to the patient at chairside. So for patients that are looking on, this is what normally most offices will do. We hope that they have the capability of checking instead of just relying on the laboratory as gospel. We know that dentistry is not an exact science, and we'd like to always have another pair of eyes, another pair of hands that can look at a case before it actually is placed permanently in your mouth. So what better person to check is the dentist at the end to make sure. So what I normally automatically do, along with the impression, which I'll show you, this is a typical impression that I would give my lab. Right now this material captured the image of my preparation in the mouth, and then from that a stone model was poured. And so my requirement for my laboratory is that we have 2 stone models poured, not only a model that they will saw into sections and create a single tooth we call a die, and they're also instructed to trim away the gum tissue around the margins. And so we'll show you what that looks like. This is the second model, and this is a different color. It's a grayer color. And you notice all the tissue is trimmed away and all the margins are left. What I normally require them to do is to go ahead and mark the margins with a red pencil or a blue pencil, just something that would show up the margin itself. So this is the way I got it back. Really should have had a line on it, did not, so I'm going to go ahead and do it now. Why are we putting this line on it? Well, before we can check how tight this is in between teeth, we've got to make sure we have a baseline in which to follow, which we know without a doubt that it's seating all the way down. So why not just go ahead and draw that baseline in? The other 2 places of concern along with the margin are going to be what we call the proximal contacts. And you can see how this one's already been marked with a special marking ribbon. The other side wasn't yet. So trying to find out why that one was marked and this one wasn't. So that's one question I have. The other is there is a third die, or a we call a pristine die, that was poured. And again, we should mark the margin on this one. This die was sealed with, I believe, some type of die sealer. There was a slight little overextension on the margin that I trimmed just before recording. So I did go in and just see that, and I wanted to get that out of the way. How did I trim it? I took a brand new scalpel and we just raised the magnification, and I went in with a 15 bar Parker blade and just trimmed it away very gently. And sometimes you could take it all the way up to a higher magnification and then trim that area. Why am I trimming it? Because it was an overextension. It was a little bit of gum tissue that was in the way, and I just trimmed it away. Alright, so that being said, again, we have the impression, which is this. We have the first pour becomes a cut model so that we can remove individual pieces. And then we have the solid model to check the contact so that food doesn't get in between the teeth. And now we're ready to double check the margins. So that's going to be our first step, is let's check the margins. All right, I do teach a course at Florida Atlantic University, and we are in the middle of showing undergraduate students the technique of checking margins, proximal contacts, and making their own crown. So let's go ahead, let's move forward. We're going to seat this first. This is the crown. It's called an Emax crown, all ceramic. There's absolutely no metal within it. And I'll just gently seat it, and just to see if there's any daylight or any voids around the margins. Now, this side seems to be fitting pretty well. That red margin seems to be going right to the contact. Then I see a little bit of daylight in the, we call a facial area. So maybe the lab could have trimmed away more of this pristine dye so that we can actually see that facial margin a little bit better. So there's some daylight in there. Let me blow that up. And if you can look real close, you see that crevice right there on the facial margin. And when we come around, and we see now it seems like it's seating again. Okay, so what does one do first? Well, we take this dye, which is the pristine dye, and we're going to go ahead and spray it with a special spray called Quick Check. It's red Quick Check. I'll go ahead and do it. I'll mix it up and spray it. And just a thin coat. You don't want to put too much on it. Okay, so now it's been sprayed. It looks like spray paint, but it's called Quick Check. Feel free to comment or write in. I'll be able to direct you in the right path. Now, the key here is to just gently place it on there and then push gently. All right. All you want to do is pick up where it marks underneath and then make that adjustment. And then we'll get this to seat a little bit more. And then once it seats on this die, then we'll go to the solid model, and we'll probably be able to adjust those contacts very easily. Okay, so as I look at this, I'm going to notice right away that there's a number of areas which picked up the red mark, so I'm going to go ahead and adjust those areas ever so lightly. And I'm also checking margins, because sometimes there might be a glaze on a margin that might be holding it up a little bit. So I take a normal white stone, a slow speed white stone, and I do clean it thoroughly with another type of stone, and then some acetone to make sure that there's no debris in the stone itself, or just use a new stone. And then I'm just going to go ahead and make those adjustments. A little bit there, a little bit there, a little bit there, a little bit there, some right there, and a little bit right in there. You get the idea. So, and like up in here too, just lightly. Alright, and we take that and bring it back to the die again, and then just slowly put the two together again. And I can see that gap space is getting smaller and smaller now. So, without a doubt, fit check. It's important. Somebody has to do it, and you have to do it with a gentle, thin film thickness of this fit check material. I'll show it to you. It's called Quick Check, and I did cover this on another video, but this is the material. Red Quick Check indicator spray. Give you the company's name. That's the website where you can go and the 800 number. But that's the main company. You could probably get this through Banco, or you can go through Cardinal Dental Supply. Comes with a spray top and then a long tip on the end of it, and this is what goes over, and just gently you go about 2-3 inches maybe from the die itself, and then just spray it. This comes out nice and easy. You can barely see it. There it goes. Alright, that's the idea. Okay, so you have the tooth now in your hand, the crown and the die. Put the two together again. Take a good look at that. On and then off again. Again, it's marking way down there. And we're going to adjust that. See, you either adjust it now or you're going to have to adjust the tooth, because that's where it's going to connect with your tooth, you know, because it's just more than likely will not seat properly. You want to see more marks around the rim and less marks internally. So maybe, you know, the lab could have adjusted that first, prior to glazing. The other thing is, you know, there might be some things internally here. For instance, just a small piece of glaze that might have ran inside, and no one can really tell, you know, what it looks like. Again, this is taking it to a microscopic level, but still, when you're in the mouth, you really want the best fit that you can possibly get. I know I'm a dentist, and if I had to have a restoration placed in my mouth, I would want something of the best intimate fit that I can get. So again, making these adjustments here and here. We're getting more marks around now, which is good. There we go. That seats pretty nicely now. Okay, so let's back down on the magnification. So when we're finished with die checking, I'm going to do this a little bit more. I want to move now to the solid model, which is here. So we'll slowly slide this down. Now it may want to seat a little bit more. So again, you have to increase your magnification. And you're seeing that some of these red lines are a little further away now from the crown. So that means this crown is not seating passively all the way down. How can we check that for sure to make absolutely sure that it's not seating all the way? Well, we take our BK31 art foil. This is a material, articulating material that's going to mark on one side. Okay, and it won't mark on the model side, but it'll mark on the crown side. We'll slide that in first, push down on the crown, and then pull through. And we notice that it's kind of stuck right there, so it's binding a little bit. Okay, there's the mark. That's where the contact is, so that's where we'll start to make our adjustment. But how do you know it's that one and not this one? Well, what I normally do at my office is I look to see how much of a red line, how far away is the red line. Is it more on the on one side than the other? And I look in between the teeth to check that. So that's what I do. And on the lingual I don't see it as much, but on the facial I do. So I still kind of question things a little bit as far as the seating. So now I'm going to move the paper to the other contact. And let's just see how that one is. Down on the mag. Put the paper back in. hold it. It pulls, but it doesn't tear. And so if it doesn't tear, that's pretty close. So I would further check the die itself and make sure if it is fitting fine. Light adjustments here and there. Put it back on there. Pull the paper through, see if you get a little better fit. So now what I would do is just take a white stone. I have a hunch it's one or even both of the contacts, so I'm going to lightly adjust them. Okay, and then lightly adjust this one. And push that back down. And take the paper. Push your crown down, pull it through. Pulls a little better now. Push it down. And try to get that paper in there. There we go. And then just pull it. It's still tight now. So the distal's tight. I'm going to adjust the distal. And just adjust anywhere it's red. I use a special porcelain stone, a white stone. It's an old Shofu brand. I believe you can still get them, but they're made for porcelain. Still a little tight on the distal, so my focus is going to be on the distal. Now there's another method where you can actually pour 3 models, cut one section away, and then just adjust the contact on one, and then cut on the next model, cut this section away, and then adjust the mesial contact, and then have one final model just to double check them both. That's another way to do it. Takes a little time. Mesial's still pretty good. Distal, much better. And maybe mark these margins again. Margins up to here. And down all the way. And still. So I'm going to adjust it a little bit more. And when I'm finished, then the next step is to adjust any occlusal contacts that seem like they're high. Now this model articulates pretty well. I'm going to leave it upside down because I don't want the crown to fall off. Alright. But there it is. And when I run my paper through there, into the bite that I want, it should make contact. Now that ran through without much contact, so let me reposition the model, because you do want at least 2 contacts on that tooth, somewhere on a marginal ridge, and it's a little light. So we do have 1 contact. There it is on the palatal cusp. For uppers, I normally like to see a contact of the lower somewhere in the central fossa or in a fossa somewhere, along with a cusp tip. Alright, that's it. From here, just a an ongoing quest to keep our quality control at a very high level. We try to communicate, so this filming of this case will then be on YouTube, and then our laboratory can also view it, and they can see what I'm going through and I'm checking as the cases come through. 2 or 3 or 4 days before they come in, I'm able to check it. My time usually is Friday morning or Friday afternoon. On the days that I teach, it'll be the Friday afternoon to check these cases. All right, so this is Dr. Jerry Cuomo. I'm happy to give you this information. It's important information, and we must continue to keep our quality control at a very high level for the patients out there. It's important that their crowns fit, beautifully in the mouth with a very nice intimate fit and aesthetically pleasing. By the way, this case was a D3, Vita D3 shade that we selected, and we also selected a stump shade, I believe, of a natural dye material of a D4 or D5. So D3, I'd say we got pretty close to a D3, almost identical to the shade tab, which is so important that you get the color right, especially with all ceramic. And then we know that the tooth underneath is going to have a darker shade, so we want to mask the tooth, the dentin or the tooth underneath, and so this material is obviously going to do that. So, all right, this is Dr. Jerry Cuomo. I'm glad you enjoyed the video, and please stay tuned for our next one. It'll be on another case. All right, take care, and thanks for watching.